Hi, everyone. Welcome to episode 32 of the How to Become a Doctor video podcast. If you haven't checked out the other episodes, definitely go watch them. But we have a sort of double clicking on some of our episodes. You guys have maybe seen our episode with VCOM, our osteopathic school in Louisiana, in Monroe, and with clinicals across the state. And so we're kind of taking an episode here to look more into the idea of osteopathic medicine and something you'll hear about called SOMA as well. But just wanted to introduce myself. I'm Matt Duras, one of the pre-health advisors at LSU, part of the phase office, pre-health advising and support and education. And, we do the pre-med, pre-dental, pre-optometry advising for all students and alumni. And we're doing this for you guys to help you just prepare for the medical field. I'll have our director introduce himself as well.
Hi, everybody. Thank you guys for joining us. We're excited today to have an opportunity for you guys to learn about our medical school in North Louisiana, VCOM. And so I want to thank our guests for joining us, and hopefully you will um, learn about some other opportunities for medical school.
So yeah, I do want to pass it off at first to our guests who are going to do a presentation. We'll have questions after that. But one of the LSU grads you're going to hear from is Laura, who was on our campus. As one of you guys way back when, and now is in medical school, and now the train is moving towards becoming a physician and all that. And so I'm going to pass it off to her, let her introduce herself, and have her presentation.
Hi, y'all. I'm Alora. So I go at VCOM, Louisiana, currently a second year there. I'm also the president of the SOMA chapter here, this year's chapter. You'll hear from a previous president of SOMA as well, and a president at SGA who's also with me. Like they said, I'm a graduate at LSU. I graduated in 2023 in biology, and I had a minor in psychology. So I've been where you are. So hopefully the presentation will help kind of show your options and what's out there for you. All right. Can everybody see everything okay? Okay, perfect. So today we wanted to go over VCOM, Louisiana, SOMA, and all things DO. And Sydney Kennard will be helping me out with this presentation as well. She also is a second year at VCOM, Louisiana, and she is on the chair for pre-SOMA, and you'll hear more about that on the national level and at our local chapter. So Sydney?
All right. Hi, guys. Very nice to meet you. As Laura already said, my name is Sydney. I am the pre-SOMA director at VCOM Louisiana, and it's a privilege to be here. So I guess I'll get started. VCOM Louisiana and VCOM just in general, a great campus to be a part of. VCOM in totality, our mission is to prepare globally minded, community-focused physicians to meet the needs of rural and medically underserved populations, as well as promoting research to improve human health. Um, this picture was actually taken on one of our international trips, and that is a huge benefit of going to VCOM because we do have the opportunity to get to go to an international mission trip to either Dominican Republic or Honduras. And so me and Alora, I think, will be going to Honduras later this year, and I'm very excited about that. Yeah, we'll move on to the next one. All right, so we have four campuses at VCOM. Our first campus did start in Virginia, and that started in 2003. Then we moved on to the Carolinas campus, the Auburn campus, and now Louisiana. And our Louisiana campus has been here or since 2020. And we've already successfully graduated two classes, which has been very nice, as well as having 100% success rate in matching. So that is kudos to us. We are doing great jobs. Very happy to see that. And definitely a reason why I wanted to come to Louisiana. So really happy to see that. Move on to the next one.
All right, so I just want to talk a little bit about what is a DO. I'm from Slidell, Louisiana. So honestly, when I went to LSU, when I decided I wanted to go to medical school, the only thing I knew about was MD. I have a lot of family who was in medical field as nurses and nurse practitioners, still had no clue what it was, what the difference was. And there's a lot of misinformation out there. I had a lot of family ask me, well, if you want to be a DO, does that mean that you can't be a surgeon if you want to be a surgeon? I'm here to tell you that's not the case. So I'll go over just a little bit of our differences real quick. All right, so DO versus MD. As you can see, we go through a lot of the same training. The main difference in our training is that DOs actually go through 200 plus hours of what we call OMM or OMT, which is a physical form of medicine that we do. A lot of people compare it close to massage therapy or chiropractor, and that's not quite what it is. We use real research-based medicine to treat somatic dysfunctions. And DOs on the rise, so you might see some DOs in your area that are offering this treatment. We do have a slide going over kind of what OMT is, so hopefully I can give you some insight on that. But as you can see, we also have an emphasis in primary care. Specifically, like Sydney said, our school focuses on rural health. So VCOM definitely lets a lot of pumps out a lot of doctors into primary care. So that's your family medicine, pediatrics, OBGYN, internal medicine, all of your primary care fields. So if you're interested in any of those areas, VCOM is definitely a place for you. DO is definitely a place for you. So I'll go ahead and show you kind of what is OMT.
Osteopathic physicians strive to help their patients be healthy in mind, body, and spirit.
All right, thank you for that. OMT is a really great um, thing to be able to do. I'm personally very excited to be able to learn about the body in that way and be able to just have my hands on a patient. So thank you, Laura, for letting us know about that. Now on to student life. I love the student life at VCOM Louisiana. I'm originally from California, Los Angeles. And it's a huge jump to go from one side of the country all the way to the other side. And so VCOM Louisiana has definitely made it a really easy transition for me because we have that community and the ability to always have some type of event going on. So even if it's a school ran event or a club ran event or just people wanting to get together, there's a very strong community. Our class is about 150 students per class, and we have a very good connection with the class that's ahead of us or the class that's behind us. And so it's very intermingled. So some of the things that you see on this slide are we have the Mardi Gras ball that happens in the beginning of each year. And that's always a really good time. And there's a couple pictures around there. Some people are wearing masks. We're dressed up. We get to eat. We get to, fellowship and hang around everyone and like to see. But it's like the medical school prom. So that's always really good to see. We also have things like the anaphylaxis workshop. I know we did the Narcan workshop just a couple weeks ago where we're always getting to learn new things. We have different physicians that come around and they teach us what they're doing. And so it's always a learning environment, always some fun, and being able to connect with the community around us. So student life is fantastic.
All right, so I just want to talk a little about what is SOMA. SOMA stands for Student Osteopathic Medical Association. So our campus here, every student who joins VCOM is a member of SOMA. SOMA offers a lot of great opportunities. As you can see, I'm in a couple of these pictures where we're in Nashville for the largest osteopathic medical conference. There's another picture of us in DC and in Chicago, so that we met with the AOA. SOMA is a form of advocacy, so that's what my role as president is. A lot of times I go to these conferences to advocate on the behalf of the student body at VCOM and for students of osteopathic medicine as a whole, but mostly for the people who voted for me into this position. I get to hear their voices and elevate it at the national level. As president, we also do a lot of stuff locally that I'm involved in. So you can see a picture of us in front of the state capitol, actually in Baton Rouge. So we went there to go ahead and listen to some testimony and give our own thoughts on some things that were going to be affecting the community, medically underserved areas, and just as a whole in medicine. So SOMA has a lot of great opportunities, but we have fun too. You can see in the bottom middle picture, that's us holding one of my classmates up at a trivia night that SOMA hosted. So we also want to promote student wellness, and so we host a lot of fun events like Mardi Gras Ball is hosted by SOMA. Splash Bash is also a way for us to kind of let off some steam at the end of the year. So we're involved in a lot of things. I'll actually show you in the next slide some national opportunities that SOMA has. So as you can see, SOMA has programs for research, overdose prevention, community, diversity, equity, health initiatives, osteopathic medicine, and professional development. We also have a pre-SOMA chapter that Sydney will be talking a little bit more about so that undergraduates can get involved. But the big thing about SOMA is that we're the nation's largest network of osteopathic medical students. So this is our way to really elevate our voices, especially in a growing field, to let the body know that we have opinions, we have concerns, and we also have things that we want to continue to do better. I really like SOMA. It's allowed me to travel and grow as a professional and really learn what being an osteopathic physician will be like and being what a student does for you. So, Sydney, if you want to talk a little bit more about what it is to be involved in pre-SOMA, I'll let you go ahead and take that over. But really, SOMA just has something for everybody if you want to get involved.
Agreed, agreed. As Laura already said, we do have a pre-SOMA, section 2 SOMA. And so it is a way for pre-medical students to be able to join the medical community before getting into medical school. And it's always a way to be able to help and figure out if osteopathic medicine is for you. There's there's an international position as well as local positions on each campus, of course. And so if you are interested, you can definitely visit the email or the website that's on the slide. And I think it's always a great opportunity here at the VCOM Louisiana campus. I am going ahead and trying to get people even younger. So we are going into high schools and letting people know what osteopathic medicine is. And so if you are interested in being able to, get the younger people interested in the healthcare field, and especially within osteopathic medicine, I think pre-SOMA is definitely for you. So it's a great, great part to be a part of. And there's a lot of perks as well. So scholarship opportunities, different national conferences that you can be a part of. And I think it's always a great opportunity to be able to talk with other students, talk with other physicians. And that's exactly what pre-SOMA gives you.
To piggyback a little bit off of what Sydney said, going to these national conferences for my presidential duties that I have to do, we got to see a lot of the pre-SOMA students there. They got to do workshops, they got to do CV training, got to talk to actual program directors at schools. It's a really great opportunity that I wish more students knew about. They're also working on, I believe, Sydney, a mentorship like training to where they can try to connect current pre-med students with current medical students and possibly even different schools. So it's definitely something that's worthwhile. And they have discounts. So if you like things like, I think Kaplan's one of the ones they have discounts for, and Janu Scrubs. So I think that's all we had for y'all.
That's about it.
Great. Yeah, thank you guys for sharing a little bit about that. And I do want to emphasize, definitely check out the other VCOM you're trying to not really understanding osteopathic medicine or just what, DOMD, they merge into the same residencies, right? So just want to let you guys out there know, wherever you go MDDO, if you show up at residency, you'll probably have different letters there, shoulder to shoulder. But like we're talking about, there's different experience, for medical school, since residency will be the same situation. So, we have a few questions for you guys. Just kind of cutting back, to your old undergrad self, put yourself back in those shoes, try to think about some things you'd want to hear. And the first question I got for you guys, and any of you guys can answer, is just this idea, what surprised you about medical school?
I think for me, it was honestly that I could still have a social life, and do more things outside of just being a student. If you had asked me when I first started, I would have never run for SOMA president. I looked at Christine and I was like, she's a superhero. I don't know how she does it. I can't handle all of that. I got to focus on school. And doing stuff outside of school, forget it. Like there's just not going to be time. But VCOM does a really good job of balancing it. They kind of integrate a lot of community events and social events to where it doesn't feel like you're taking time out of school, but you're still getting that space to enjoy your time in medical school. I've had a great time. I've made friends here that I mean will be lifelong friends. I've had opportunities that I never thought I could. So definitely just keeping your options open and not letting yourself become just a student and letting yourself be you in school.
To piggyback off what Alora said, one of the things that surprised me during medical school is that you'll be surprised how much you can take on whenever you put yourself in these uncomfortable situations, because that's where you grow and learn the most. So I know it sounds daunting when you're like, oh man, like I should study all the time, every day, all the time. But then when you set like those times to yourself to spend time with your friends and all that stuff, like you learn how to prioritize things, and then you also learn what's important to you, what's not, and it really allows you to kind of just grow as a person, grow as a professional, and then the training that you get, you learn so much within 1 year, you kind of forget until the next like class of students come in and they're like learning, oh, how to use a stethoscope or something like that. You're like, man, I can't believe that was like last year when I feel like I've been using it every day for the rest of my life for a while. So that's, you grow so much in medical school. Just enjoy the ride, and also like you'll be surprised what you can accomplish when you put yourself in these situations.
Complimenting what Alora and Jimmy said. Hi, I'm Christine, by the way. I'm an almost 3. I'm so happy Alora is taking over my steps as SOMA president. And I'm so happy also that Sydney is spreading the word about osteopathic medicine, because even in Louisiana, the last state to licensure osteopathic physicians, we have a great duty, I think, to spread the word, because I personally think osteopathic medicine is equivalent to allopathic medicine, and we just have one extra tool, um, one one skill. We could work with patients, and that's OMM, osteopathic manipulative medicine, where we could use if they need it, if they have a muscle ache or something bothering them, we could work on it at the physician visit. So, to answer the question, what surprised me most about medical school was the support. I think because osteopathic medicine is so new in a way, we all, as students and physicians, we work together to educate everyone, and because of that, we're in the same team, and the support I felt on our campus, especially in VCOM, was the warmth, of even the first day, where they're on your side. They want you. I was there for our in-person interview. they just want you to succeed. And I felt that even from one of our deans. And my experience through medical school too, I felt their support with my education when I was struggling with personal issues. When a family member died, I was struggling um, with my exam and test scores, but they sat me down. They said, "Hey, what's going on? How can we work with you so we can help you reach your goals?" So that was what surprised me most. Maybe Sydney has something to say.
Yeah, I can definitely piggyback off of that. I think maybe what surprised me most was the fact that I didn't feel that there were gunners in our class. The stereotypical people that will do anything to push everyone down and make themselves get, go higher and ascend. And I think that that's amazing. I mean, who wants to have to compete against their own classmates? And so that was definitely exciting to hear and not have to experience firsthand. Of course, hearing other class or other friends who go to medical school and they're like, "Oh, I hate this person," and da da da. So yeah.
Great. Well, thank you for sharing that, that you guys, and yeah, definitely you don't have to feel like you all have to answer every question, but also it's great hearing from your perspectives. And I was thinking about this idea, of the journey of medicine you guys are talking about, and it's some positive things that you surprise yourself how much you could do. You can still have a social life and all those kind of things, but it also you're asking that question. It surprised you because you guys knew medical school is hard. You knew it's a long journey. It's not for the faint of heart. It's worthy calling. And so I'm often sitting with students and they're trying to decide this journey. I saw you had the MD and DO table showing all the years of training as a doctor. And I know some students are confused. They don't realize that as a third year, you're already doing medicine in a hospital, and, even residency, you're getting paid and you're a doctor, but it still is a long training, right? Even if it's not that many years of school, it's a long training. And so my next question kind of comes from the student who's to kind of figure out, do I want to be a doctor, or do I want to be a nurse, or do I want to be a PA or a PT? So, from you guys' perspective, how would you help an undergrad understand maybe the role of a physician, some pros and some cons kind of thing, that they can make an informed decision, since it's not for everybody, but it's also, such a wonderful full calling.
Yeah, I mean, I can answer this a little bit. I actually started off at LSU as nursing. I switched after my first semester because I had an injury with my shoulder. I needed surgery. I went in as a patient and saw the surgeon. And I looked at him and I was like, that's what I want to do. I had been in the medical field around nurses my entire life because I have a lot of family who were in the nursing field. And I got to a point where I was like, I want to be able to understand the biology and the pathophys behind their decisions. I want to understand these tests. And I wanted to have a little bit more autonomy that I felt like a physician's role fit me a little bit better than nursing did. Although I heard from a lot of my family that, you're going to lose some of your patient time if you become a physician rather than a nurse. Like nurses get to spend more hands-on time with their patients, which sometimes is true. It depends on which setting you work in. But I really liked the mental aspect of working top down from the case and figuring out every single possibility of what this could be, and kind of being a leader in their treatment and what their options were, and really understanding the disease as a whole. So it kind of made sense for me to switch gears, but I also considered all my options. If I were to give a student right now the advice, I would say shadow every single thing you can. Go volunteer, go to an MD, go to a DO, go to a PA, NP. I worked as a medical assistant under an MD surgeon and under nurse practitioners, and I got to see the difference in their field. There's a lot of similarities, but there are some differences in the work-life balance, the liability behind things, and kind of the business aspect of medicine as well is a little bit more on the physician's shoulders at times. So it just depends on your goals, and what you want. But the best way to answer that question is to go find out. go shadow as much as you can.
Yeah. Thank you.
To piggyback off of what Laura said again, she's just saying so many great things. So it's just easy for me to follow up on. So for me, the decision was ultimately like I wanted to be the patient's like last line of defense, or in a sense of like I want to be the person that makes the decision and follow through with it, right? Because with PAs and nurses and stuff, you can make decisions and stuff, but ultimately it falls on the doctor. So that responsibility is what I kind of like run towards, I guess, because I find it like if not, these other if not them, then why can't I do it, right? Or like vice versa. So I always ask myself like that calling of like, hey, when someone is in dire need and they can run to me, I find that like very comforting. That means like I built some level of trust. I've built like and then I also like trust my training. I trust what I've learned, and I've built myself. I worked hard on all of the things I've learned and how to use it, right? And how to apply it. So that's just like the perfect mix and balance of like what I find challenging, what I find like fun, and what I find like uh, that's like part of my calling. And while at the same time like bettering my community, bettering the health of my loved ones and stuff like that.
So Matt kind of alluded to most of the people that will watch this podcast or that we work with are sort of the pre-meds students who are doing this. So just kind of we talked about a little bit about what surprised you about medical school, but thinking back to your, you know, pre-med days, what's something that you are glad that you did as a pre-med that helped maybe prepare you for medical school, and then maybe something that you wish you had done that could have helped you once you got there?
I would say I would probably start with what I wish I did. As much as I enjoy biology, I I think I could have been okay with just getting a minor in biology and maybe majoring in something that I felt was more connected with who I was in that moment. Um, because if you get the prerequisites, that's really all you need to be able to get into medical school. And so if I could go back, maybe I would have been a Spanish major, maybe I would have been an art major, maybe, there's so many other things. And I think it's not often said that you don't have to go into a science field to be able to go into medicine. Because at the end of the day, having another, background really helps you, do well in medical school because you have a different thought process. But something that I would do again, I used to work as a medical scribe as well as working in home care and being able to have that patient care early on was very helpful. I was working with very different offsets of patients very early on and being able to learn about different diagnoses or being able to connect with different types of people all across the area that I was in. I was in Northern California for my undergrad. It definitely helped me be able to learn how to communicate with different people, learn how to problem solve at a very early age, as well as getting paid in school. So, yeah.
I agree with Sydney. I think it's best to do what you love. Know who you are and do what you're good at too. Because what I did um, pre-medically, I love to cook. I In my family we cook to heal. Also, we cook for gatherings. I like to learn culinary medicine. So using um, different recipes to help with cancer patients. So I went into culinary medicine, volunteered for that, met a whole bunch of great people. I got into lifestyle medicine for prevention um, for all these chronic diseases. Um, so that's what I did for pre-med, I highly suggest just to try things out, see where you go with it, and from that journey, you'll know who you are, and you bring that with you everywhere you go. And if you decide to do medicine, then you know that you want to be part of someone's care decision, their whole care plan. You are probably the one who are just curious about everything too. That was me. I just wanted to know why. And I wanted to bring my background, my perspective as a physician in someone's care plan. And so, yeah, that's my biggest advice, just to try everything, try it out, and then bring it with you.
Specifically at
Sure.
LSU, you should listen to your pre-med advisors. As much as like I know some people, you know, they don't want to go to all the pre-med events. It's another thing to do. I get it. I wish I had done it sooner. And that's like me being completely honest. Because I switched later, it took a little while for me to kind of figure out all my options and like what was out there for me. How to train to go to medical school. I didn't start off in pre-med. So I didn't know kind of the journey, the steps to take, the timeline. So by the time I got to my junior year and everybody started studying for the MCAT and they were like they've already taken it, where they're ready to start applying, I was like, wait, no, like I'm not there yet. And I think both of your pre-med advisors do a really good job of telling you the hard things to hear, the things you need to hear, what you need to do without being discouraging. Honestly, I've heard horror stories at other schools about pre-med advisors sitting them down saying, you're not going to be a doctor, you need to switch to this. Or, I never got that at LSU. I sat down and had the hard conversations, what my scores were, where they landed me, what I needed to do differently. But I went to the pre-med stuff. Once I hit that wall where I was like, whoa, I need to get my ducks in a row and start doing what they tell me to do. I went to the events. My application was so much easier because I went to everything and they told you exactly what you needed to do and they helped you where you needed help. I just wish I had started joining the club earlier and known about all the things that I could do earlier. And I wouldn't have done as much content review during the MCAT, but that's a whole other thing. Practice questions all the way. But yeah.
We didn't pay her to say that, just so y'all know. So
Uh, so for me, I guess the question was, what's one thing as a pre-med that you like glad you did, right? So for me, I'm an untraditional medical student in a sense of like I didn't get into medical school until I was 29. So I joined really late. But I took multiple years off between college and applying to medical school. But during those times, during those years, I shadowed doctors. I worked as a scribe. I worked in multiple practices. I worked in family med. I worked in ophthalmology, and I worked in spine surgery. And at the end of the day, I was like, hey, you know what? I think this is really what I want to do. So I put myself out there. I experienced, the clinical side of medicine, the surgery side of medicine. And I realized that this is my calling. This is what I want to do. But at the same time, I saved up money and I traveled. I saw the world. I'm not saying I didn't come from a rich background or anything, but I saved up money. I worked like multiple years to save up that stuff, went on trips, kind of allowed myself to experience the world and experience like a bunch of things before I started medical school. So then when I started medical school, I was able to really hone in and be like, hey, I got that all in my system. I'm a lot more mature now. And I was able to really focus on what I wanted to do and chase my dreams. So that's something that I think every student and every person needs to do in their life, is just allow themselves to experience life. And then through trying multiple avenues, you can figure out what you really want to do.
Great. Well, yeah, thank you guys so much for sharing. There's so much more to say, but we do have to make sure we don't exhaust the topic. But I just wanted to see, how could they connect with SOMA, maybe an email address or something like that if they have more questions. SOMA at VCOM, I mean.
I can give them my personal email, and my phone number. My cell is also attached to that email. So if they ever have any questions, please reach out. I love helping undergrads, especially at my alma mater, figure out what osteopathic medicine is and what VCOM's about. Because again, without the advisors at LSU, I would have never known about VCOM. I probably wouldn't be where I am now, or it would have taken me way longer to get here. So, again, just reach out to me. I'm happy to help. And the pre-SOMA National also will help you at different schools. And I'm sure Sydney will say the same thing.
Well, thank you to our guests again, and thank you for watching.